Welcome to Touch Revolution, the podcast where the value of thoughtful, helpful, and ethical touch is fully realized. Brought to you by Ke Kino Institute of Healing, a rigorous massage school and clinic. Join us on this journey as we delve into the world of touch therapy, exploring its powerful effects on the mind, body, and soul. So, get ready to embark on a captivating exploration of touch therapy. It's time to revolutionize the way we heal, one soothing touch at a time.
Hey guys, this is John James. I am the owner here at Ke Kino Institute of Healing, and you're about to watch a podcast. This podcast is with Marnie Manus, one of our master level therapists, and she's interviewing multiple Swedish massage therapists in our building. Swedish massage is the one technique that all massage therapists enjoy together. They all know Swedish massage. We have a lot of reverence for this technique, and we train really rigorously for this technique here. So sit back, enjoy your time watching this, and then afterwards, give us a call, and we'll hook you up with a Swedish massage. Thank you.
What is Swedish massage? My name is Marnie with Ke Kino Institute of Healing. I work in the Master Clinic and teach CEU classes here, and I am so excited to introduce my colleagues to help you understand what we do and what is Swedish. Brendan, please introduce yourself.
Sure, thank you. My name is Brendan. I'm a generalist therapist here at Ke Kino, and I'm also the Academy's admissions representative. I'm a graduate of the massage therapy program, and I'm very happy to be here. Thank you so much.
My name is Alexis Espinoza. I'm here as a generalist therapist at Ke Kino, also a graduate. I work within the facility, in the front desk, and then TAing all of the CEU courses.
I'm Kat Jones. I've had a lot of different positions here at Ke Kino. I'm a graduate of Ke Kino. I am an instructor here, and I've taught 3 different classes, and I also have a practice of my own.
Hi, I am Colin Voto. I am a generalist therapist here, part of the Finding Zero Clinic, along with Alexis and Brendan, and thank you for having me on today.
Thank you so much. So the first question of the day is, what is Swedish massage?
At the framework of it all, at the basis of it all, it is, effleurage, petrissage, deportment, flowing strokes moving through in my opinion, decently simple, but overall, like kind of simple technique and flow throughout the entire body. But at the basis of it all, in my opinion, it's a framework of power, movement of energy, and the connection between one person to another through touch, and in its most simplest and relaxing form.
Beautifully stated.
Well said.
Anybody else have something to add?
Being a student of Ke Kino, that was initially what we first learned. The sequence of a full body Swedish massage. Pairing that with the anatomy, the kinesiology of the body to have a base knowledge of how to work with the body. I feel like it is the base, the foundation of massage for me personally, but for most therapists.
Thank you for sharing that. In the words of our fearless leader, John James, I believe that he says that Swedish massage is the one modality that unites all massage therapists. So we do a lot of things above and beyond Swedish that we call body work, but almost every body worker does Swedish massage at the foundation. Would you agree with that?
Absolutely, yeah.
And can you tell me how a client could best participate in their own massage? How could they get the best service, the best outcome?
For a client that is receiving the work, it's all about being, in my opinion, open, but also present during your massage. Whenever your therapist is moving through the strokes, moving through and finding areas of tension, pain, or even emotional blockage, move your attention into that space. We are energetic beings at the core of this, and our attention is where our energy will move to. So if you're just spacing out and disassociating during the massage, you're probably getting maybe 20% of what true value you could be getting out of it. But if you actually focus in and rein your being into the moment with the therapist, you connect on a more intimate level. And the energy shared and the energy exchanged is so much more pure, potent, and you will feel so much more revitalized than just sleeping for the hour.
Thank you.
Mm-hmm.
If I can articulate that, what I heard you say and what I've experienced is that when a client can stay present, when the discomfort level is low enough that they can stay fully present, that they don't disassociate or go out of their bodies. I've had clients that say, "Oh, I can take a lot of pain," but they're not present. So they consent verbally, but their body says no. And if I understand you correctly, what you're experiencing is if they stay present and can feel what you're actually doing, the effects are more effective, more profound.
More profound, definitely. And the
Yeah.
breath is going to be, in my opinion, the biggest piece for your expansion of capacity, for your ability to take more pressure, well, not pressure necessarily, but to take more work, to take into the work more powerfully. You have to breathe. You have to breathe into yourself and into that place.
Thank
Okay.
you. All right. Anybody else?
Yeah, well, as far as preparing for the best experience for a Swedish massage, coming in with an intention of, knowing what are you looking for? What are you seeking? And, jumping in on the presence with that, keeping that intention and being, using communication throughout your massage to guide us into what feels good, what doesn't, where are you at. And there are certain moments where hopefully your massage therapist will be asking you specific questions to keep you within your body, to keep you in that moment, within that intention. And there are certain times where maybe they'll have you close your eyes and go off into some kind of visualization. So there's different ways to prepare for that, but I think intention is a really good way to prepare for a great massage.
My clients and I, we always work together with the intention, because I want to make sure that they leave with what they came for, right? If they came in and they just needed some peace, or they needed relaxation, or they needed release, or they just needed some human touch, we work together with that, with the breath work, with intention throughout the session, and then at the end, making sure that they feel like they received their intention.
I love that. Thank you. Thank you.
I kind of want to speak on this idea of disassociating from the session as a client when you're on the table. Because for one, it's very easy to do, because as we're working in different areas, it's so easy for many things to come up for the person receiving the work. And I think that's something that we do very well here in holding that space and noticing when the client is starting to disassociate, and then intervening, right? Or very gently nudging them back into their body and keeping them within the experience rather than having them float off. And I'm sure you can all agree that it's almost tangible as a therapist when they start to disassociate, and we almost lose our own kind of energetic touch with that person, right?
It almost pushes you out of the tissues.
Yes.
Yes, I notice that the tissue stops responding.
Yes.
What do you notice something similar when the client starts talking about random things that are happening in their life?
Their muscles tighten up right away, for sure.
I experience a lot of like comedic relief. And I personally do that as well. When I go to a certain spot, I'm like, oh, I don't want to do that. I'll crack a joke or something. I had somebody put me in my place the other day when I was doing it. They're like, okay, like I can tell that your laughter is, you're guarding. And I was like, okay, you're right. Let me get back there. Let me get back there.
Wow.
Yes.
Thank you for sharing that.
And we have multiple, layers of us too. So if we just lay there and have thinking we're getting our physical layer addressed, it's way more than that. We have our energetic, body, and our mental body, and our spiritual body, and our emotional body, and we're addressing, all of those things in a session.
Absolutely.
Absolutely. Thank you. We are a busy working clinic, and Colin had to step away, but we've been joined by Nick. Nick, would you like to introduce yourself?
My name is Nick Nelson. Glad to be here.
Thank you for being
Glad
here.
to be here.
All right. So go ahead.
All right. If I had to introduce myself, I've been a body worker for 8 years. Damn, 8 years. It's crazy. Started at Ke Kino 2015, graduated 2016. I want to say that I started working here, 17. I started teaching in 19. And this is all I know. That's all I know.
Thank you for joining us today.
Hey, I'm glad to be here.
Yeah. So let me ask, what are some common misconceptions about Swedish massage?
That if I had to think about one big one, is that it's a newbie thing. It's for the newbies. Once you get advanced, it's like you don't use it anymore. It's like it's for beginners. It's a beginner's modality.
As a
Yes.
as a therapist?
Yes. Yeah. And it's a truth. So I can't say it's a misconception because it is a truth. It's a baseline. It's the beginning point. But I feel like it's the best. It's the best way to begin the journey as a body worker. You show me a body worker that can perform a good Swedish massage, and I'll show you one that can do amazing craniosacral, amazing lymphatic, amazing ART, amazing this, amazing that. Because it's like if you're good at Swedish and you understand what it is, all other modalities become easier to master and learn. You know, so.
Good point. Thank you.
Hey, you're welcome.
What else have you heard from the public about Swedish massage?
Just rubbing lotion on someone.
It's a luxury, right?
Fluff and buff.
Yeah, you get that at the spa, at the resort, right? It's a luxury.
Right. It doesn't hurt? Does Swedish massage hurt?
It can.
Can, but I probably shouldn't.
It shouldn't.
Not if I do it.
It shouldn't.
Do you have to use oil for Swedish massage?
I would say, I would
Use
think
lotion or
you would have
cream.
to use some type of product.
Something.
Yeah, something. You don't want to give a drop. Yeah, come on. Yeah, we don't want to do that.
We're not doing myofascial release here.
I think I read somewhere that some body workers thought that you had to use oil instead of cream, but I have never learned that. I like cream.
Yeah. I was always taught it's a choice, or depending on like,
Mm-hmm.
I mean, every session is going to have its own vibe and like need.
I use coconut oil mixed with lotion.
Mm-hmm.
Yeah. What should clients expect if they book a Swedish massage?
Okay, I think they should expect full body. I think that's one thing that should be expected.
Would you define full body?
We're gonna work basically head to toe. It's face, it's scalp, it's neck, it's shoulders, it's back, it's chest, abdomen. If it's okay for the client, if they're okay with it, we're doing abdomen work as well, glutes as well, all the way down to the feet. We're working everything.
So if I can understand you correctly, that's everything except the genitals and the breasts and anything else the client doesn't want you to touch.
Correct. I think all body work is like up to the client. Even anything that you want to do is if it's okay with the client, if they're fine with it, do it. If not, it's okay.
Right.
It's absolutely
Consent.
fine. Consent. There we go. Client consent.
And we're adaptable. Right?
Absolutely,
that.
but I think that's important also to empower the client to speak up for themselves.
Yes.
So if you were to have advice for someone that's never had massage, that's going to a spa for the first time, what would you advise them?
Okay. Person who's never been before. Speak up. Speak up. If something doesn't feel comfortable, say something.
Yes.
Yeah, you're not going to hurt the client or the therapist's feelings by telling them that it's too much pressure or not enough. Like, seriously, speak up.
Absolutely. And the common misconception of no pain, no gain is not the way to think about it.
Yes,
and not the way to
yes.
go into a session as a client. Because you can receive so much more and have so much more benefit if it's outside of your pain threshold,
So if it doesn't hurt.
if it does not hurt.
Yes. I totally agree. So that's the question.
Yeah,
There
that's
is
a
a
good
lot of thought out in the world that people will book a deep tissue because they think Swedish massage is only for relaxation. So they book a deep tissue massage and they expect it to hurt. And they have this idea, no pain, no gain. Is that true?
Nope.
There's definitely a difference between deep tissue and deep pressure.
Yes.
So you can access deep tissue through very light modalities. You know, as we're speaking of Swedish massage, having a deep tissue Swedish, yes, that may apply more pressure, but also range of motion. There'll be different movements, different holds, different unwindings. It doesn't necessarily need to be painful once again.
Amen. Amen. My request to my clients is they speak up, is that we have a communication, an open door to communication. So if something is uncomfortable, to tell me. And my body work typically is below the pain threshold. That's my goal. I find that the client tissue will not respond if the client is experiencing pain. So I explain to them that it might hurt. You might consent to the pain. You might be able to take it, but your body's not really responding. And then we have to educate. Do you find you have to educate your clients?
All the time. I always let them know that it's bees to honey, right? So you can be sweet to the muscle and you can ask it to relax rather than force it into relaxation, where you can absolutely do that. But it's much gentler if you're nice to the muscle.
Yes. Earlier we were talking about disassociation. Do you find that makes a difference in how the tissue responds?
Absolutely. If the client is focused in on that specific feeling or tension, and can breathe with it, can move with it, can let the tissues know that they are safe, let the tissues know that it's okay.
Yeah.
We're here to help. Then I find much more release from that tissue.
I see that as well.
Also, in educating our clients is letting them know that the pain source is not necessarily the problem source.
Thank you. Yes. Would you like to speak a little bit more about what we do here? It is exactly that.
In class or just in general?
In the clinic, I would say that what we're known for is not just treating the place that hurts, but treating the source of the pain, the underlying source of the pain.
The primary barrier.
Ooh.
Yes.
I was like, these two, I feel like
Would you like to define primary barrier?
Oh gosh. Brendan?
I think for context, part of the main philosophy and the approach that we take here is that the symptoms of the physical body is really just a reflection of what the emotional body is going through, right? And so the approach that we take to body work, whether it's Swedish or not, is that we can't truly affect the physical body without affecting the emotional body as well.
What is primary barrier?
So the primary barrier is the root between the connection between what the physical body is experiencing and what the emotional body is experiencing. And so as we navigate life as adults in this world, we are constantly putting our experience into a physical location within our body to hold it for us so that, one, that's a common disassociation response as we navigate life, right? Or just the body is like innate attempt to protect itself. And so finding the primary barrier is visible in the client's voice, in the way that they carry themselves, in their energetic signature. And so part of what makes us so different in the work that we do here is feeling for that and connecting with our clients on an energetic level so that we can see it and we can listen for it, and then holding the space to properly navigate their own transmission and transmutation through that process.
Brenda, that is incredibly well articulated.
Thank you.
Can I just say how impressed I am? I have been a therapist for many, many years, and my training was in medical massage and therapeutic massage, and we were taught that the pain in the back is very often from the front. So from a structural standpoint, I had to educate my clients that I will rub that place that hurts, but can I please work on the parts that are causing the problem?
Mhm.
Step one. But what you have done here, what John has done with the teaching program that you have been involved in, is taking it to the next level. So now we're incorporating the energetic signature. Now we're incorporating the emotional trauma that's held in the body that is the underlying source of the pain. And I am just so honored to be a part of what we have created here. It's
And
really well articulated. Thank you.
I'm so grateful for the education that we've received, because
Yeah.
it does make us stand out, and it's so much more empowering as a therapist to be able to have these tools under our belt and to be able to educate the client about what they're experiencing. I mean, just validating someone's experience through very like tangible experiences that they have
Yeah.
is so empowering to them, because they're like, I'm seen now, right? I'm not alone, and I have someone here that sees me and knows this experience and has walked it.
Right. Wow, Brendan, thank you so much. I think you've really done a great job of articulating what bodywork is, which is really the signature of what we offer here. Can you share a little bit about what is the difference between Swedish and bodywork?
Anyone is welcome to answer this one with me. But
I
lost my
think
train.
That's okay.
well, Swedish massage is a component of bodywork. So if you think of bodywork, as you had said earlier, as an umbrella term, where underneath the umbrella of bodywork, there is Swedish massage, there is deep tissue, there is myofascial, there is, even chiropractic work, sound healing, energetic work. Those all can be coined as body work. Anything that is affecting the body in itself. And then utilizing, what we do here is utilizing multiple modalities to achieve the direct results of that client's intention, coming in and helping them work through their, whether it be corrective, whether it be energetic, whether it be emotional, and all of it, right? It's all one thing.
Swedish. Swedish is an amazing tool if we want to dive deeper into body work. Because I'm going to do, again, like we said before, Swedish is full body. I get a chance to assess everything that I feel. Everything that's going on, my hands are going to touch it. And I think when you get good at Swedish, like really, really good at Swedish, your ability to intermingle all of these other modalities becomes that much more, has depth to it. Swedish doesn't feel like Swedish anymore. You get done with what you think is Swedish, and the client is like, what was that?
Yes.
And you're just like, no, that was Swedish. Like, no, it wasn't. I've had Swedish before, and that wasn't it. It's like, no, that was my Swedish.
Yes.
It's like, that was like part 1. You want to do part 2, 3, 4, 5? We go deeper.
I love that.
Yeah. So that's one cool thing about Swedish, is that it allows it's the gateway, in my opinion, to stepping into a whole, the deep, big world of body work. It's beautiful.
Very well stated. Very well stated. What can a client expect when they book a Swedish massage?
As far as just the experience,
Well, I'm wondering, I have an idea what people experience out in the world. And I would say that when they come here, unless they're booking a student Swedish, what they get is probably a whole lot more than what they received elsewhere.
I don't think we can help it here. I don't think we can help it. I don't think we know, like, when it comes to Swedish body work, where do we stop?
Where does Swedish end and body work and begin? Yeah.
I don't think we know how to slow it down, or I won't say that there's no such thing as completion, but it's like where we can go on forever. We just keep going.
Right.
Yeah, we're gonna find something fun.
Right.
I think Nick is saying we don't know how to not make it a very personalized experience catered to that individual and see what it is that they need in that moment. That's what we don't know how to do.
I love that. I love that. We acknowledge our limitation.
Yes, right. Sorry.
Don't apologize. It is. But it is what makes a advanced therapist. That is what makes a quality body worker. That is what we do and what we teach, is how to not just go out there and apply lotion and do a routine,
Yes.
but to make it unique for the individual, to bring in all of my gifts and talents and intuition into that session. I feel like it would be doing the client a disservice to do anything less. And I tell them that when they come in and tell me what they want. It just feels good when I get this massaged. I'm like, great. I'm happy to do that. But I would be doing a disservice if we didn't address the root of the problem. Is that okay with you?
How could you say no?
It's one of those things where I will happily give you what you want, but before the end, I'm gonna give you what you need.
Ooh,
You won't even know that you needed it, but I'm gonna give it to you
there you go.
And keep you coming back.
over and over again, over and over again.
But noting that we do offer Swedish massage here at Ke Kino through our student clinic, and they are supposed to be doing just Swedish. So that way, if someone does ask for specific pain management or even deep tissue, we let the clients know that our students are practicing Swedish specifically, so they can accredit their hours and go on with their programs. And that is primarily to create consistency within their work and offer that modality to the public.
Agreed. Would you like to describe what is a student Swedish? What would a client expect when they book a student Swedish?
Well, in Swedish class, we are learning that as clients or as therapists, we have healing to do as well. And so the students here have been through their own healing or started the process. It's ongoing usually.
Can I clarify? You mean the therapist?
The
Our
therapist,
students who are learning to be
healing
therapists.
of the self before you
Wow.
heal others, right? Or help others to heal.
And you're talking
And
about
it's-
emotional healing.
I'm talking about all of the layers. Yeah, all of the layers. Because, some of us have come in with old injuries that once you start learning Swedish, those things are like flags, right? They just start showing up. And then you have the emotional layers and all of that comes with it, right? So we first are healing ourselves here, and then we're learning to hold space for our clients' healing. And so when they come in to receive, they will have a very mindful therapist that will be able to hold space for their healing and also attentive and be able to filter through all of the different layers like we talked about and see them. Just, in the baby steps, they'll be able to, once they're not students anymore, they'll be able to expand upon that. But the clients that come in for our students have the option of undressing to their comfort level. So as a student here, I had somebody come in and they stayed in their jeans and they took off their shoes and that was it. So that was their comfort level. And I learned to do a massage on Wranglers,
And conversely, other people take everything off, even their underwear.
Right. And so that's their experience, whatever their needs are. But they will address all of the areas of the body that Nick was talking about earlier. What works for the client. The abs is usually a new experience for people when they come here. I had never had an ab massage before, and I thought it was a little weird at first, but it's great, right?
It's great. We've learned that it's really important too, right?
Right. Yeah. And then they will have great follow-up service, and the therapist will ask them to come back and work on things that they need, they couldn't do in 60 minutes or whatever.
Beautiful. So for someone who's never received a massage before, do you have any advice or anything you'd like to tell them to expect?
Anybody else have something? to add?
Can I add in?
Yes.
I would expect for them to be greeted respectfully, to be asked what they would like, if there's any areas they want worked on specifically or anything to avoid. I would ask a new client to speak up. If they're scared about something, if they're uncomfortable, if they've never had a massage and don't know what to expect, explain that to the client and to really feel self-empowered to speak up. There is this thing of fight, flight, freeze, or fawn. And I find occasionally people will just lay there and take it even if they don't like it. And that's the absolute worst thing in the world to do. It would be better to just stop the session and say, I'm just not feeling it. I need to go. Pay your bill and leave. It's only $35, $40. But really for a new client to expect that it's perfectly normal to get completely undressed. Most of my clients, if they get undressed, they take off everything. Some people choose to leave their underwear on, and that's perfectly acceptable. My client's modesty is more important than me needing to access whatever. They should expect to be covered, to be
Completely
warm.
covered the whole time.
To be warm. If they get cold, ask for a blanket. Ask if they're uncomfortable and need a pillow under their knees or under their head, to ask for that. And to expect the therapist to only uncover the parts that need to be uncovered. And that they're, in the United States anyway, the breast will always be covered. The genitals and the gluteal cleft will always be covered. So
Here at Ke Kino, even if they're males, we use the same breast drape as if we do for the females.
in the student clinic, yeah.
Yes.
Yeah, okay. Nice to know. Thank you. So, yeah. Anything else you'd like to add for newbies?
I do have something that, it's one thing that is kind of thrown around. Just as a client can stop the massage if they are uncomfortable or there is something that, is not within their, ability to grasp or whatever it is. The therapist can also decide to stop the session if
Thank
there
you.
is any inappropriate behavior, if something may happen, if anything is said, and so that is a right of the therapist as well. So if you come in hot saying things like happy ending or what have you, we will, especially here at Ke Kino, immediately end that session, and you will not be allowed back here.
Absolutely. Thank you for bringing that in. And it's really sad that we still have to, but it still exists in the world. And I would say that flirting with your client, with your therapist, is totally not acceptable, especially making any sexual innuendos or trying to expose yourself. It's really sad that we have to say that, but it happens. And but not here. But flirting with your therapist or making sexual innuendos are really in bad taste. And my favorite joke is, "Let me go call your ride." What ride? The one that they bring red and blue lights and pretty silver bracelets. So it's really sad we have to say that. But you're right. The therapist can end the session, and that. Can I tell a story?
Yes.
Please.
When I was early in my career, one of my therapists that I work with, she worked in Hawaii, right off of the naval base, and these young sailors would come in fresh off the boat, and they would ask for happy ending, and she would say, "I don't do this, you need to leave." And she would send them out the door and not get paid. And her boss said, "We can't do this. We're losing all this business." And I was shocked. I'm like, this is what we're taught. We have a no tolerance policy for that, right? So she changed her approach. She said, "Well, that's not going to work. So what am I going to do?" So they would come in, they'd ask for a happy ending. She said, in her best mom voice, "That is not available here. If you could behave and be nice, you can get a really nice massage." They said, "Yes, ma'am." They paid. She got paid, and it was all good.
Great.
Thank you for letting me share.
Absolutely, yeah.
I fortunately do not have any stories to share about that. So, and thankfully here at Ke Kino, our clients do behave.
They know better.
Yeah.
No, redirection.
Thank you.
It's a big thing.
Yeah.
It's a huge thing, especially for that person who's never received a massage before, they heard about these places
Yeah.
where things happen. They're like, we'll go try something. Let's say they did come into here, which in my tenure, my 8 years of it's never happened.
Yeah.
It's never happened. But I think things are different being a male in comparison to being a female therapist. I can say that redirection for me is probably it's simple in comparison to if there's a male on your table and they're making suggestions and things of that nature to redirect them, being a woman. What I want to say, your confidence, your sternness, I'm going to say this, I don't know how it would sound. That man or that, person is some cowardice there. It's a little bit. So when you get big on them, they will get small on you and they'll back away. And your ability to, I guess, exert that I am a confident therapist, that's not what we do here. I don't do that. They'll back away. They will back away.
Yeah. I've seen that too. I've had people try to start to ask questions like, have you ever had people flirt with you? I'm like, they get fired. So it would be a good idea for me not to flirt with you? Absolutely not. Please don't do that. Just like clear and to the point, like stay confident and there's no options. There's no door. So it's much easier to stay straight. I will say that I've noticed that younger therapists who come in with more of their sexual energy, maybe more energy like they would have out in the world or out in the club, that they may get more solicitations or more inappropriate clients. I try to bring this energy of the elder, not even necessarily feminine or masculine, but just holding space for spirit. For me, as I get older, I feel like I can bring the grandmother vibe, and nobody wants to hit on grandma. So, but I've actually really enjoyed being here in this place at Ke Kino because it feels much safer than other places. Like we don't bring that energy of people looking for services that we don't offer. People come here for healing, and it's okay to be feminine, to be a woman in this place, whereas in other places when I was younger, it didn't feel safe. I mean, I used to wear scrub tops and put my hair back and, hope that they didn't notice I was actually female. It's kind of sad.
And that safe energy is so tangible too. Yeah. Like I mentioned earlier, I'm the admissions representative, and so I give tours of people that have been here for the first time around the building, and I hear so many times that they're just like, it feels so safe here.
We do that. And I think that we create this safe environment, but we also teach people how to hold themselves in a way that's confident and safe. And it creates that safe space for healing for our clients. Yeah. Thank you.
Ke Kino has a good rep. It does have a good rep. I've noticed, again, that type of, we're going to say negative solicitation does not happen here. I can only recall once where there may have been a stir up, but it was squelched so quickly that you didn't even know that it happened.
Right.
And I think that's also a testament to the team that you have. The question that I always, when I was teaching, I would ask, you move different when you know who's backing you. So who's backing you? And you know that you have John, he has 30 years. Marna, you've been in double digits. Kat, myself, you have all these people who have been in the game for a while who will back you. Nothing is going to happen to you in this space that we're not going to allow anything to happen to you that cannot happen. Are you going to grow? Are you going to feel uncomfortable? Yes, but that's the good part.
Exactly.
Those are the good things. But there are other things that, no, out in the world in some establishments, you're not going to feel that here.
Absolutely.
It just doesn't happen.
Yeah.
Yeah.
And probably that's a whole nother session, but talking about alluding to the uncomfortable feelings and how we grow from that.
Mm-hmm.
That's a whole nother discussion about what we do here. What an amazing conversation. I did not know where this would go. As we wrap up, what do we think about just dropping in all the modalities you can think of that are part of bodywork? And I believe that John says the one thing that unites bodywork is touch.
Mm.
That is the one thing that encompasses body work. So Swedish,
You gotta have it.
craniosacral,
You gotta have it too.
Myofascial
Yeah.
release.
energy work.
Yes. Lymphatic drainage.
He stole mine.
I'm sorry, Kat.
Muscle energy technique.
There you go.
Trigger point.
Hydrotherapy. Stealing all of Kat's.
Let's see. What are some other
Ashiatsu.
ashiatsu?
Somato-emotional release.
Big one. Really.
Visceral.
Oh.
Rolfing.
Yes.
Visceral manipulation.
Traeger.
Traeger therapy. Like literally, we could list every modality that's
Reflexology.
reflex. Right. We need a list, but really, it's everything. And the interesting thing enough is all of those modalities were a therapist who got really good at something and decided to teach it and had to give it a name.
Mm.
And I think what we offer is Brendan's body work, Alexis's body work, Kat's body work, Nick's body work, influenced by all of those people that you've been taught by, but also those ones that have touched you
Mm.
or that you have touched. And the combination of the skill set that we've developed over our lifetimes, even before you went to massage school. And what's really important that most people don't know is the internal work. What I think, tell me if I'm wrong, but what really makes us unique in our body work is the emotional healing that we've done for ourselves. And what that does is it opens up this capacity for intuition to really flow and to also be able to advise and help others along that process. So we hold space for a lot of emotional healing, a lot of tears. Anybody else?
No, I think the power, that power, it may be tough, but how can you help it if you've never touched it, you've never gone through it, you've never experienced it before?
Oh, yeah.
You know, I cannot, if I want to step into the role of being a guide, I've never been to New York. I'd be a terrible guide. I don't know what to do there. But when it comes to helping a person get to a point, I'm going to break it down where they stand up straight, lift the head up high. They are open when they speak to people. Confidence is coming through. I've been on the opposite of all those and had to come to that point. So helping a person through that process is personal. It's a part of, I'm not just showcasing my skills as a therapist. I'm showing you, like, I've gotten through life. I've gotten through life and I've made it. I've been through some interesting things in life, some tough places, some dark places, and I'm still here. So, yeah, this body work is a good place, but also there's nothing emotionally that you cannot conquer. Trust me. Trust me. You know? So I think that's something that we offer here that's extremely powerful, is that thing.
Thank you.
Yeah.
And what's the difference between the emotional healing that we do here and what they might receive at a psychotherapist office?
All right. So I kid you not. This was maybe 3-4 years ago. I had a lady come in. She was only in for 90 minutes. And she said, Nick, I'm going to tell you something. I said, yes, ma'am. She said, I've been going to therapy for 10 years now. What we accomplished in 90 minutes is equivalent to 10 years of therapy. I said, there's no way. She said, no, you don't understand. The body work combined with for me, the talk therapy was phenomenal. It took everything that I was speaking about, I felt, and then you felt it, and we worked on it, and now I feel like I'm not the same. That thing is unique. That ability to, I want to say rapid. If I had to give it a term, if we were talking about, hey, somebody just got good at something and coined something, I'm going to say rapid release. Rapid release is what we've gotten good at. Let me add on, I want to make it sound even cooler. Rapid transformative relief.
I love it.
That's what we've gotten really good at here.
Yeah.
Yeah. I like that.
Why do you think that is?
Training. The training that you receive, like with Kat, what she's doing. When I was teaching, there are things that Kat now does, and I'm like, that's actually kind of dope. That's actually dope. I'm glad you're doing that because you're making people look into depths of themselves that they did not do when they were with me. When I was teaching Swedish, it was like, I'm going to teach you how to be a really good body worker. That's my goal. Kat showed me that it's like you can do that and show them how to be a really good healer. That may not involve body work. It may involve just thinking and sharing your thoughts with other people. And I think to answer the question, it's the training that you receive here that brings out that unique thing that we offer to the field of body work. It's the training.
Wow. And thank you for pointing out that even in our school, which is extraordinary, we are continuing to evolve. Wow. Thank you. Thank you for bringing that.
And I can speak to your teaching, Nick, because Nick was our Swedish teacher. We are badass body workers.
Yes, you
are. And here at Ke Kino, we were also offered an immense amount of training through the graduate program. Marnie was one of my mentors, and then mentoring with John James. And then, of course, just having these beautiful people around us and helping us and working with them have really helped us to heal. And speaking on that, doing that deep inner work, the more that I am healing, the things that are coming up for me, I find are directly reflective in my clients, and I'm able to tap in a little bit more and, start to almost mirror them. People start coming to me and they're like, oh, this happened. And it would be something that I am working through.
Isn't that interesting?
Yeah.
Yeah.
And from there, it's like, okay, well, this worked for me. Let's try it out. And usually really good results from that. So, thank you.
And that's what's so cool about here is, and what Nick was talking about, we've all been through different things in life, and that is what gives you your medicine, right? Absolutely. Your experiences, and then you begin to draw those people that have the need for your medicine in.
I love that.
I love that. I find it so fascinating that the universe seems to deliver the exact people that need to be on my table, or the ones that I can most help from the experience that I just had a month ago or 2 months ago. And I often call Ke Kino a laboratory for personal growth. All right. Thank you so much for being here today. This has been so fun. I had no idea what I was signing up for. All right. So in conclusion, what would you like to share? Any last words of advice?
Self-care is where the healing is at. And just by taking the time to book an appointment for a Swedish massage, then you're taking your healing into your own hands.
Beautiful.
I think, that in itself, but taking that step, and even if you have never had a massage before, knowing that you can, if you call into our front desk, we have trained front desk staff that can help walk you through, talk you through your specific needs, and pair you with a perfect therapist, and one that will help you and allow you to introduce into the wild world of body work and your own self-healing. And you can take that, into wherever you want from there.
Thank you.
Giving it a chance.
Yeah, thank you.
Last words. Love on yourself. Please love on yourself.
Yeah.
Start with Swedish. Reach out to other things, but love on yourself. It's not too late. You're not too old. You're not too this. You're not too that to start loving on yourself. And you'll get a lot of love here. You get a lot of love. If you don't know where to start loving on yourself, come to Ke Kino. We'll love on you. You take that out into the world, love on other people.
We love you.
All that's in my head right now is just the power of a building that operates under so much authenticity, and like in an environment where authenticity drives our work. And I think that's really powerful. And so if you're looking for something that you can't put a name to it and you don't know what it is, but you know that it involves like-minded people and a space where you can truly be vulnerable and process something that you have not known how to process, and this is the place to do that.
Thank you. I have had so much fun, and I am so honored to be here with you all and be here today. My advice for people is make your self-care a priority. Love on yourself. If you can't come see us, you might have to take your chances out in the world, but book a Swedish massage and speak up for yourself. Swedish massage is it's going to be different for every therapist. So just because you had one experience with a therapist, don't expect the same experience from another one. But start somewhere and ask for what you want. Speak up for what doesn't work for you and allow that therapist to do their best work. So I do my best work when my clients say, this is what's going on, you do you. And then they feel empowered to speak up if there's something they don't like for whatever reason. And this really is a unique place. I'm thrilled to be here. I'm thrilled to be here with you guys today. So thank you. Thank you all for showing up.
Thank you so much.
Thank you so much.
It's been
Thank you,
really
thank you,
fun.
thank you.